allowing us to get the recording in place. So welcome to the Tompkins County Council of Governments meeting, February 24th. We have actually the agenda isn't as full as it started out. So I think we can probably still end close to 4:30. It might go over just a little bit. There's some things that we've moved to future meetings. So is there any, I don't know what the greeting, sign in, review agenda. Anyone have questions about the agenda or have any quick comments before we go to approving the minutes? Seeing none. We'll move to, do we have a quorum? Can we approve the minutes, the December 2nd, 2021 minutes? Katrina, we're all set.
We're all set. We have at least 9 for quorum, so we're good.
So would someone like to move approval of the December minutes?
I'd be happy to.
Was that Joe?
That was Joel, yes.
Okay. Oh, Joe, we're still, okay.
Yeah, I'm here in 2 ways.
Does someone like to second?
I'll second.
Katrina, who did you hear first? Bob Lynch seconded. So any comments about the minutes?
They were excellent.
So all those in favor, raise your hand or say aye.
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 Anyone opposed? Anyone abstaining? Minutes are approved. Moving on to report from county administration. And Lisa, I think I'm turning it over to you. Is that correct?
Yes, that's correct. Thank you, Rod, and good afternoon, everyone. I thankful for a few minutes on the agenda. We wanted to provide a quick update on the county's Reimagining Public Safety Initiative, and joining us this afternoon, I'm glad to announce or introduce Deanna Carruthers, the county's Chief Equity Diversity Officer, as well as Mona Lita Smiley, who is our newly hired Community Justice Center Project Director and has been with us for about 6 weeks. And also just want to acknowledge Dominic Recchio, who's been working on this as well. I'll hand it over to Deanna, I think, to give the overview.
Sure, thank you. And also I want to acknowledge, I don't know if you mentioned Shelley Michelle Nunn, she's here as well, our colleague from the city who has been working with us as well. And so we try to, so first of all, thank you for the opportunity. We'll keep it brief, but also just want to be informative, knowing that you have a full agenda today, and we're happy to come back and just share any updates that we have. And so it's nice to see lots of familiar faces. So if it's okay, I'll share screen with you just for a brief presentation. Can you all see my screen?
Yes, we can.
Yes.
Okay, thank you. We also want to just again start by saying this mural and some of the presentations here are representative of our community. So each one of these things you'll see are actual spaces and places here that represent the work that we're trying to do here in Tompkins County and in the city of Ithaca that pertain to justice, equity, inclusion, and also just our including all of our towns and villages as well. All right, did my slide advance?
Yes.
So what brings us here was a thank you, Rod. I appreciate an active participant here. Our charge here specifically relates to Executive Order 203. When during the killing of George Floyd, there was a massive uprising throughout our nation around social justice. And so former Governor Como issued Executive Order 203, and the city of Ithaca and Tompkins County partnered on what was known as the Reimagining Public Safety process. To bring you up to speed, both the city and the county passed joint resolutions at March 30th and March 31st, respectively, making sure that we want to ensure that there is equity and inclusion throughout our community. One of those things in terms of the plan was to create a community justice center to do the work, because everybody knows that you need a vehicle to exist. And so that community justice center became we're bringing the community justice center to life so we can implement these joint plans. Specifically, our community justice center, we recently hired a project director, and I believe Mona is here. And so Mona started a little less than 8 weeks ago. And so we're so excited to have her work with us as a tireless champion who has over 25 years of experience working throughout the criminal justice system, working with the underserved youth, but also has a large network, family, friends, born and raised here. And so that comes with a certain level of credentials and importance here. I always describe this place as a very, very special place in that being homegrown means something different. I happen to be from the great state of Kansas, from Wichita, Kansas. And so I have learned that people here in Tompkins County love their people. And I think that's really important. So as a new project director, she's located in the mental health building, because again, public safety and the work has been an intersection between law enforcement and our mental health response. And everybody wants to be safe, and we think that's critically important. She's been meeting with city and county stakeholders, but then also she'll be leading the efforts to implement joint plans. In terms of the processes here, the city of Ithaca specifically will present their redesign plan to Common Council on March 2nd, 2022 at 6:00 p.m. And if there are questions about that, Shelley is on here as well, knowing that there's still lots of work to be done. And then some of the other plans here, at the city of Ithaca will, once those lead into the joint plans with the collaborative, we'll continue to work together on the alternative response for wraparound health and human service delivery, the community healing plan, and then the Tompkins County pilot program for unarmed response. Some of the plans in progress, again, I just mentioned specifically the city of Ithaca is going through a departmental redesign process, specifically looking at how to improve their service delivery and improve equity within that service delivery. In terms of a collaborative plan, we have the community healing plan. One of the things that we identified is there's a loss of trust within minoritized groups, between minoritized groups and law enforcement. And so how do we build that trust? And some of that is acknowledgement and understanding each other and some of that work. And so we're doing some work within the Black and Brown community specifically, and then also having initial conversations with law enforcement on what that will look like. And so knowing that this will be a broader discussion with the community, knowing that everybody has a role in feeling safe in the community. In addition to the community healing plan, we also have the alternative response for wraparound health and human service delivery. One of the things that came through very, very resoundingly in the feedback was that the community wanted a different response for looking at mental health calls. There were challenges with de-escalation, understanding what mental health needs are as appropriate. Specifically, law enforcement, that one of the things that law enforcement officials stated in their focus groups was that they had too many jobs. In other words, there are too many things that law enforcement is asked to do. There's very few positions in life where you go to work and you're asked to solve every societal problem, whether it's an unhoused issue, a socioeconomic issue, whether it's a racial issue, whether it's it could be anything. And so law enforcement has unfortunately been tasked with doing too many things. And so how do we support them and being able to keep our community safe while at the same time aligning those services? And so that's what that plan is specifically about, is understanding what alternative responses are needed, specifically around mental health response. Then the county specifically is working with the district attorney's office and assigned counsel on publicly disclosing data and understanding what their statistics are like. The district attorney's office recently completed an assessment through Measures for Justice and to understand what's happening in the office, what supports might be needed. And so as soon as we receive those findings back, we will share those out as well. Another major initiative that we're working on will be officer wellness. We support our law enforcement officers. We want them as employees and as community members to be well, feel safe and feel supported. And so officer wellness will be looking at different keys to success, for lack of a better word, and what that will look like. We have employee assistance program, but then that's not enough. So what are the additional supports that law enforcement needs to feel that they're a part of the community in a meaningful way? Last year on the screen is the Tompkins County Unarmed Pilot Program. One of the things that we found with our road patrol was that they had too many ancillary or other duties that they were assigned to do, with it, again, being the catch-all. And so we are working on a pilot program to work with hiring specific sheriff's clerks to be able to respond to non-emergent calls. So for example, a deer down, or it could be a noise complaint, any of those things, we could potentially, you would still get a response through 911, but you wouldn't necessarily have someone drive up in their car. So we're trying to identify what that looks like. What that will leave road patrol and those other officers time to do is to build stronger community partnerships. And so we're looking forward to those discussions as they move forward. So some of the plans that we'll be working on in the future, including looking at tracking enforcement and data related to that, understanding how whether or not there is disproportionate minoritized contact here in our community. But then also we want to improve our recruitment and retention efforts of officers, knowing that we want the best officers in our community, and we want them to stay. We want them to feel welcome when they're doing good work. And so we want to launch plans that improve our efforts in those areas. So in terms of this particular group, and again, thank you for your time, and I appreciate being able to be here. Some of the things in terms of plans, we know that each of your communities have plans, especially those with law enforcement services specifically. We want to just also share that with our plans, we're happy to collaborate on training, some of the officer wellness initiatives, looking at our standardized data, but then also as we look at the alternative response, we also want to extend our hand, making sure that you are invited to the table for those discussions. And so knowing that it's completely up to you, but also just wanted to just set the crux of this particular update is that we want you to know that we're here for you, and we want to hear your voice in the process, and just wanted to identify a few quick things, knowing that, again, your agenda is very full, that we want to reach out to you regarding. What is next? In terms of some of the processes, is that we've identified that we wanted to establish a Community Justice Center Advisory Board, knowing that, again, coming back to you, we will, the city of Ithaca and Tompkins County will appoint this board, but also knowing that we'll want to have representation from multiple jurisdictions in support of this work. And then also, so we want to, again, reach out to you with opportunities and resources, knowing that some of you already have your own plans, and also if there are ways for us to work together, we want to extend our hand of support to support each other. And so with that, I will stand for questions, and I appreciate your time today.
Thank you, Deanna, and I love the use of the mural images in your presentation. That's great. And did Mona Lisa, do you want to say anything? And congratulations on your position, or Deanna, as we take questions, any number of you might respond to the questions. Is
that is correct.
Okay, so questions? Joel.
You alluded at the end of your presentation to the getting participation from the other parts of the county besides the city and the county, and you specifically mentioned those places that have law enforcement forces of their own. But what about those of us who do not? Is there any thought to including participation by, Caroline, Danby, Enfield, those of us who rely on the sheriff's department for law enforcement?
Yes, we're happy to have as much support and assistance as we possibly can. The only reason I mentioned that specifically is because each one of those jurisdictions had to submit a plan, knowing that I'm sure we can find a way to collaborate and work together on these things. Yes, absolutely. Thank you, Joel.
Robert.
Yes, thank you, Ms. Carruthers, for the thoroughness of your report. We've done a lot. We've gone above and beyond maybe what former Governor Cuomo required of us. And that builds a question in my mind. And that is Executive Order 203 is what we responded to. It was almost 2 years ago. And about a year ago, we submitted this 98-page report, which was very thoroughly done. Curious to know, has the state done anything with that report other than say thank you?
I'm not aware of it. And so how we're taking it is that I'm not aware of any official response from the state. And Lisa, you may be able to confirm. I don't believe we have.
That's correct.
Not at this point. And so how we are framing is that we heard the experiences of marginalized populations. We heard the experiences of law enforcement and the work. And so with that information, we are empowered, and we cannot look away from the information that we have learned and what we have heard to continue to support our community as we move forward.
And a second question I have, and that is, you talked a lot, and again, very thorough about process, what we've done in the past 2 years since we started reimagining public safety. I think I'm curious, and I think the people in the rural areas are curious too, about what substantive benefits we have accrued. Do you have any quantifiable substantive benefits that all this process has resulted in so far?
So when you say substantive, do you mean like particular outcomes of the plans?
Yes.
The plans, there have not. So one, for example, one outcome of the plan that will build trust among the minoritized community specifically is having our community justice center being started. In terms of the rural community specifically, I'm assuming there are minorities in law enforcement in both of those places. And so with that in mind, we want to be judicious and thoughtful in them being involved. In terms of the pilot program, we have secured 4 positions or 3 positions for the sheriff's office, knowing that the sheriff's office specifically services primarily rural areas to actually provide additional supports in those areas. That program will be started this summer into the fall. And so again, that's additional increases for bolstering law enforcement support. In addition to that, we're looking at building community trust in terms of the community healing plan. Resources have been appropriated for that work, knowing that I think everybody on this screen cares specifically about making sure that every resident in this community feels safe. And so we are targeting our time and resources to making sure that every single person feels safe. My goal, I would say, is to work myself out of a job. If there's no system inequities, I won't need a job. And so that's why I'm here to do this work. And it's not about me, but this is the county and the city putting their money where their mouth is, right? Saying we care about the villages and towns, and we're going to invest in our community in the form of approximately $1.6 million. That is an output that has been in those funds being appropriated. In addition to that, we're also have a planning study in the amount of approximately $160,000 looking at some of those areas where it's not, where there are safety concerns in terms of traffic. So that study hasn't been completed, but I could go on and on and on. And so my goal is to make sure that we feel the impact of this, of the plan. But again, knowing that in terms of government, everybody has a seat at the table. So having with having a million seats at the table, that means it takes time. So I hope I answered your question thoroughly.
The Community Justice Center, once it gets established, what will probably be its major substantive benefit for the average citizen of Tompkins County?
The average benefit is, so first of all, so in terms of Executive Order 203, the main thing was that we're trying to diversify our community and that people of color can see themselves being serviced appropriately in Tompkins County. And that is a substantive, that will be a substantive outcome of the work. Specifically having Mona here as a local candidate who lives in our community with family members, experience here will be, I can tell you, it's already sent a signal to a lot of people. I will say it this way, in the funny, frame it in a funny way, is Mona is the most famous person I'd never met. I can't tell you how many people that were emailed me, white, Black, other minoritized groups, who said, this instills trust in our process. We believe we can't, one person, they were surprised, which were unfortunate, they were surprised, but that we're doing this so that everybody feels like they have a place here.
I could also add to that answer too, is that the main task of the Community Justice Center and Mona's work is to provide the staffing and infrastructure to follow through on all of the pieces that we've set forth in the plan. So this investment helps to ensure that we have the institutional resources to follow through on our commitments, and Mona's set off to do just that.
One reason
Robert, let's move on to other questions, because we do have, by the way, if I said we were going to end at 4:30, I misspoke. We're not ending at 4:30. So just so you know, this meeting will go past 4:30. Other questions? To Joel's point, just as you're filling out the new committee, let us know how TCOG can be helpful, because there are several municipalities that rely on the county sheriff's office. I don't know that we all need representation on the committee. So if you want us to like have a little discussion amongst ourselves, so just let us know how we can be helpful, especially for those committees that rely on the sheriff's office. Other questions? So Robert, I'll circle back around to see if you had one other quick question, since no one else seems to have questions.
Oh, that's fine. We'll save it for another day. We've got a heavy agenda today. Thank you very much, both of you, for your answers.
Yeah, and we know how much work has gone into this, so so good work, and we look forward to hearing back from you guys at an appropriate time. So thank you all for joining us. Lisa, are there other things that you wanted to update us from the county?
I think that will do it for this afternoon, but thank you, Rod, for the time on the agenda.
People may want, is there just a quick update about the county administrator position, or is there no update on that?
I would leave that to our legislature. I think that it's still in process.
Okay.
Okay.
So any other questions for the county? If not, we'll move on to the next agenda item. Okay, thank you again. It was nice to meet people virtually on here and put faces to names. We appreciate that. So moving on to additional reports. I don't think Warden is on. I believe that we are moving this one agenda item to the future. This is about IT services and a possible RFP discussion. So Ben, did Warden mention anything about this?
Yeah, he's not planning to be here and hopes to move that up to the next meeting.
Okay. So then moving on to, is Mark here?
No, Mark was going to be traveling today, so he asked me to fill in for him.
Okay, Dan, so you're going to introduce the countywide emergency services response discussion?
Yeah, on behalf of our EMS subcommittee, which you all remember we formed about 2 or 3 years ago, based on the fact that a lot of us feel squeezed when we're trying to make sure that our ambulance services are covering our towns and our villages and our county. And we know it's a burden. Town of Dryden had to double its ambulance tax in 2019, and that's a tough pill to swallow. So we got this group together. It's been great. Warden Hart, who you all know is mayor of Trumansburg, and Mark Whitmer, and a lot of participation from the county emergency services office. Mike Stitley's been attending our meetings, as well as Justin Van. And one of the things that we tossed around was this idea of another way to fund ambulance service, kind of a moonshot, but hey, it's Tompkins County. We think big, right? So we started thinking of other mechanisms to address this, and maybe getting some students involved in doing research. I teach at the Cornell Institute for Public Affairs, now in the Brooks School of Public Policy. And I have a course that I can have students get involved in, graduate students, to analyze public policy problems in the nonprofit or government sectors. And, I looked at my enrollment and I saw Ben Carver was in my class. And I thought, this is starting to look good. Ben has been with the village of Trumansburg, I think, for about 6 years. Is that right? Maybe longer. And he also oversees the emergency services work in the village. And so I went back with Mark Whitmer and Warden, and we realized we could have a project here to do some research on rural ambulance services and network with the New York State Legislature, in particular, a couple Senate offices that I was familiar with and Warden was familiar with things that we could do. And you may remember that resolution we passed in the fall, urging Kathy Hochul to sign the legislation for a task force on rural ambulance services, which the governor ultimately did. I'm sure our resolutions made the difference, but it didn't hurt. And it's good that we got involved like that. But we established a relationship with a couple of these Senate offices. And, Ben and his team, he had several other members working with him, grad students working on this report. But he's continuing his study on this as an independent study this semester. And he agreed to give a presentation here today and take a few questions. So I'm going to pass things over to Ben Carver, who's Deputy Mayor of Trumansburg and a SEPA student.
Great. Thank you, Dan. I'll just start off right at the top by apologizing to Rod. We don't have any murals in our presentation, so my apologies. But I do want to thank you all for being here. Thank you for having me. This is an issue I know that affects a lot of TCOG municipalities as well as, rural communities across New York and across the country. But as Dan mentioned, I'm here to present a report that we did as a team through SEPA and in conjunction with the Subcommittee on Emergency Response. And I'd like to start, I think, first by thanking Dan for sort of linking these resources together, but also Mayor Hart, who was really our primary liaison from the subcommittee, as well as the Department of Emergency Response, which was immensely helpful in terms of getting us data, and Cornell Libraries, as well as the offices of Senators Hinchy and Helming, who were very supportive and very, I think, helpful and generous with their time and their support, which was, can't thank them enough. So as you've noticed also, the rest of my team isn't here, and I know you all have a very full agenda, so I will try and go through this fairly quickly. That said, if you have questions, feel free, please, save them for the end. Also feel free to reach out either through Dan, Rorden, or to me directly. Any and all of those will work, and I would love to field questions that may be more community specific or anything like that as time goes on. But so this presentation is structured, as you can see, sort of with a general history overview, sort of industry assessment, and then analysis, recommendations, and conclusions. And as I said, I will try and go fairly quickly. What's important, I think, primarily about the history of EMS is to understand that it really developed, it's not sort of the natural way of things. It developed in wartime with commanders realizing, we're leaving essential resources on the field of battle. They, for thousands and I don't know how long, thousands, hundreds of years, basically left wounded soldiers on the field to die. And some very insightful general said, these are resources that we could recoup if we had an organized system to pull them off and to treat them. So as is the nature of technological and general development in warfare, a lot of energy was put into this, though those systems were developed starting in sort of the late 1700s, moving through to modern warfare. And some of that advancement seeped back into domestic life. Around the 50s or 60s, the Kennedy administration and the Johnson administration put a lot of focus on what became sort of a cultural crisis, where basically veterans were coming home from foreign wars and realizing that, hey, the emergency medical care that we're receiving at home is substantially less effective than what we were receiving as members of the armed services overseas. So starting in around the mid-60s, the federal government put upwards of $10 billion in targeted grants into EMS services across the country to build research into technologies, healthcare methods, and also just to build the resilience and effectiveness of the network as a whole. Now, unfortunately, in around the 80s, 90s, that federal support really started to devolve. So the federal government stepped back, started to hand responsibility towards the states. The states, in turn, handed that responsibility over, and there was basically an overall sort of devolution towards local control of EMS, which is what you see if you look at the modern EMS industry. Simultaneously, local fire departments that had once controlled EMS response started to be overwhelmed by EMS calls, and simultaneously we're suffering from decreased volunteer numbers. This is more in the modern era, so late 2000s, maybe late 90s, sort of in that time period, moving into the present. So we have basically an increasing number of municipal or nonprofit EMS departments that are really being forced to take up the slack in situations where population density doesn't support for-profit commercial agencies. Now, that's sort of the situation in New York State, but that's not the case necessarily in every state. You can see on your screen, Ohio, New Mexico, and Pennsylvania have grant funding and fairly substantial grant funding options for local EMS services. Hawaii is another one that runs a state level EMS agency in sort of a limited and complicated fashion. But nonetheless, there is substantial state support. A number of provinces in Canada also have state support. So there are models, and Dan mentioned this is something that I'm continuing to study. So those models are something that I'll be looking into over the next couple of months to see how we might find and apply some best practices from those. But the point here is really to emphasize that New York's method in this sort of devolution to purely local control is not necessary and not the natural order. So from there, we started to look into what do local models look like? Is there a better way? Is there a more efficient way that we might transform our local agencies to more effectively cover, to be more resilient in rural America, where it may not have the population density to support paying for EMS purely with billing revenues, where we're really relying on tax dollars to subsidize these agencies, like Dan mentioned, in Dryden, also in Teaburg and Groton, and also Enfield and Cayuga Heights, although those are through fire departments. But as you can see, there's a number of differences here. The thing that I want to highlight is that across these models, what the real differences are: one, access to grant funding. So nonprofits and municipal services obviously have access to grant funding that a private company may not have in some circumstances, whereas private companies are able to operate in areas where population density is such that you can support, you can fund your agency with billing revenues. Now, across New York State, regardless of the model that's employed at the local level, EMS agencies across rural New York State are struggling. My team looked at a number of EMS reports that were by and large crisis driven. How do we survive? How do we get through the next year? In various communities, the response is slightly different and the context is something slightly different, but the underlying stress and strain really seems to be fairly universal, at least in rural areas. So we focused, as you can see, on these two SEPA reports, as well as a number of other reports that were conducted through Cornell, and also an Essex County report that was particularly instructive in terms of some of the recommendations that you'll see later. Oh, excuse me. And one of the main things that we wanted to do was to update the data analysis that had been conducted for the 2017 SEPA report. As many of you remember, Sladeville Ambulance closed its doors right around that time, and that was part of what drove the creation of that report and that earlier committee. And we really wanted to see what had happened in terms of overall response in Tompkins County in the intervening years. So here, excuse me, you can see this is a graphic that was presented in that 17 SEPA report. I won't spend too much time looking at the details. The one thing I do want to highlight is that the average is 11 minutes or thereabouts. When you fast forward to 2021, the average has gone up substantially. And I'm just going to flip back and forth, excuse me, while I go between these. But if you look at the Enfield average, it's gone up by nearly 10 minutes. So you can see also, and excuse me, I apologize for this, but I'm going to flip back one more time. If you look here, and I don't know if you can see my cursor, but you can see that the red is fairly concentrated in Sladeville. And as you move forward, what you can see is that that's much more spread out across the county. And what that tells us is essentially that resources were redistributed across the county in order to compensate for the closure of Sladeville. And I hope that what we can understand from that is really the dynamic nature of the EMS network. So if there is a threat at one node in that network, it really affects the entire network and the effectiveness of emergency response at any point on the entire network, which is something that, again, is really important to bear in mind as we move forward. Here again, I'm going to breeze through this a little bit. One thing I do want to emphasize is if you look all the way to the right in that call per square mile column, you can see the range there is 7 calls to 270 calls. So Danby has very few calls per square mile, whereas the city and town of Ithaca have very many, as opposed to population. So population is fairly clustered. It's, about 170 or 120 to maybe 250, 350 at the most. So from a policy perspective, thinking of this as something that can be tax driven is very difficult, right? Per person, translating that into tax revenue or tax dollars is very difficult. And there needs to be some way to account for the increased area and decreased population density as well. One other thing that we found that's fairly important in terms of the context, and especially in Tompkins County, is the number of calls. You can see falls is between 17 or 15%. So there's a lot of calls in the county that are, you might term non-emergent, or that are, I think, worth investigating further. That again is not something that we had the time or the capacity to do, but it is worth emphasizing, I think, especially for local stakeholders who have influence on local EMS agencies, that is something that's worth pursuing, is how do we handle these calls that are non-emergent, frequently what you call them frequent flyer calls. So one or a couple addresses that will have calls repeatedly that are non-emergent for falls and that type of thing, which may be preventable and are certainly worth looking into. We also found, with a fairly basic budget analysis, that EMS costs are rising at an incredible rate. This is something obviously that I know, that I'm sure most of you know as municipal officials, but seeing it, in a simple graphic is really, I think, quite powerful. One thing that I want to highlight here is that upper right graph shows local EMS spending by municipalities mapped against national healthcare spending. And what we wanted to emphasize here is that if you look at the equipment that's on an ambulance, it's essentially a mobile emergency room. We've moved beyond the days of just pulling soldiers off the battlefield or getting people to a hospital as quickly as possible in the back of a hearse and that kind of model. And we're now really providing medical care at the scene of an accident or while en route to a hospital. So it's, from that perspective, it's perhaps not surprising that the costs of EMS are advancing in lockstep with healthcare costs more broadly. But it is worth, I think, emphasizing, just to really bring home that point that EMS is a healthcare service. And just to kind of recap some of that data analysis, you can see overall that calls are increasing across the county. We went from an average of 21.5 to 27 calls per day, which is, I think, again, if you talk to people in the industry, not surprising, but from maybe a layperson's perspective, it's a substantial and meaningful increase. So if you compare that to, the tax increase or the monetary impact, the financial impact is greater than the number of calls, but the number of calls increased is substantial. And you can see that it's a substantial tax on those EMS agencies, on individual providers, and certainly on taxpayers who are sort of footing the bill in many places for that. And also, as I pointed out, you can see that the resources have been reallocated to cover Slaterville.
Sorry, Anna. Oh, so all of your files?
Oh, excuse me. And I think from that, we can really deduce a fairly basic SWOT analysis that I think is helpful to emphasize. So the obvious strength here is that, as Dan mentioned, Dryden's EMS funding doubled in 1 year. And there were no riots in the streets, no pitchforks at town board meetings. None of that happened. We have, I think, a real strong cultural belief in the provision of EMS care. EMS both as first responders and also as medical care, we have a strong cultural belief that is something that government can and should provide, which in terms of the resilience of our network is essential. It really enables the network to work. That said, EMS, and this is similar to police and mental health response that Ms. Carruthers was talking about before this, EMS frequently becomes what they call the safety net of the safety net. So when there's no one else to call, we call EMS. And this results in a lot of non-emergent calls, a lot of call increases just across the board. It also results in a sort of trickle down where it becomes very difficult to define accurately the problem. It also, again, creates a threat in the form of political pressure. So at a certain point, there will be a tipping point between cultural and community belief and faith in EMS and it being required. So I think it's important to be cognizant of that. And that's one of the reasons that one of our primary recommendations of this report is some form of state or county funding and to advocate for that. But one thing we also found is that there are a lot of opportunities for community and particularly county and state support for EMS services and for the EMS network as a whole. I'll get into those a little bit later in the recommendation section. So one of the most important things that we came away from this report with was the need to reframe EMS, both as a healthcare, both as a medical industry, but also as a regional network. So in any network, there are nodes, and it's easy to fixate on those nodes to say that maybe the problem here is with this agency or this model or that model. And we believe that the focus really needs to be on the network itself. And I think Tompkins County is actually a really helpful case study in that instance because of the closure of Slaterville. So you can really see visually the impact of those network effects across the county. One thing that I think is also important to emphasize is that because EMS is healthcare, we can understand volunteer shortages in community resources in general, whether that's volunteers or tax resources, as part of that broader trend in healthcare services. So from that, there's a number of things that are fairly simple and some that are more complicated for the county to do. And I think actually it's worth taking a moment to just pause and sort of tip my hat to Mike Stitley, who in maybe an instance of parallel thinking, or maybe he got there before us and we just didn't know it, I don't know, has already started to implement some of these things. And I think in a way that's really, really, really beneficial. And hopefully we'll start to see positive impacts of those things moving forward. That said, at the county level, one of the most important things that we think should be done is addressing frequent flyer calls and how to understand the liability of those calls and reduce the frequency. Also providing some sort of access to data for local municipal officials who may need to make real-time decisions about resource allocations, having some idea where resources are in the county outside of the CAD system, where you can local agencies can see the real-time allocation of where each ambulance is, but knowing how many are on staff but not on a call, that kind of thing would be very helpful for local agency officials. And then also just to develop more fully talent pipelines for EMTs and paramedics in the county, and to coordinate local trainings, that kind of thing. Now, from a policy perspective, the leverage points from the county level in local EMS are tricky to discern because of the way that local EMS control has devolved from the state down to local municipalities. So the county has leeway to some degree, but it's difficult to really delineate the line between municipal responsibility and county responsibility, excuse me. That said, because of the dynamic nature of the network, there really is an increased ability for the county to leverage those network effects. So if you can create a medical director, create centralized quality assurance and quality improvement mechanisms, those sorts of things go a really long way. Obviously, this is a municipal group, but I think the hope is that as a group, we can move towards these things and not only push the county to take more proactive steps in this regard, but also to encourage our own community members to be supportive, as as Mike Stitley starts to implement some of these improvements to make sure that our own local EMS agencies are supportive and we as policymakers are supportive as well. We also came up with a number of recommendations for the state level that I think are fairly important. I won't go into these in too much depth. We have, as Dan mentioned, we had a fairly substantial interaction with a number of state representatives that I think was really beneficial. And I think they have heard these recommendations on some level, as he pointed out, who knows how influential our recommendations were, but they certainly have begun moving in this direction. The task force has been implemented. There is also now at least a draft bill to begin state level CHIP style funding for local EMS agencies, which is really a big movement. I think historically at the state level, EMS was one of, I think, Governor Cuomo's favorite bargaining chips, in that he would sort of add it at the beginning of the budget and then take it out at the end. So it really does. Obviously, Governor Hochul also included EMS in her State of the State address and substantial support for it. So that's something that we feel really positively about, and hopefully that will help us as we move forward at the local level. We also have a number of areas for future research. I won't read this list, but I'll just say that for myself, where I'm hoping to focus is establishing a way to quantify the population density threshold that allows private commercial EMS agencies to exist, so that when we're targeting either county or state funding, we know where that threshold is so we can be more effective with any funding. And then also and I mentioned this at the top, but finding best practices in other state agencies and state funding mechanisms. And I just want to end by emphasizing that the EMS network around us in Tompkins County is effective. It is exceptional in a number of ways. It's, if you look at the reallocation of resources that happened sort of around the time of Slaterville, that really is a testament to how effective our EMS providers are locally. And the difficulty is that resilience is really, the resilience of our EMS network is really happening on the backs of individual providers who are being asked to provide more and more and more. And there's a sort of internal contradiction between the state policies or lack of state policies, lack of state support for those providers, and the effectiveness of that network. And at some point we will, I think, as policymakers, have to step in a more proactive role to really support the local EMS network. But I will end it there. I'd be happy, as I said, to take questions either now or certainly by email if you don't want to ask in this moment.
And I think that we can take up to 10 minutes worth of questions. We're going to really derail our agenda. So my guess is we're certainly planning on this being discussed, not just at this meeting, Dan, but at a future meeting as well, correct? You're on mute, Dan.
Sorry, I was muted. Yes, I think it would be great. I just want to let you know that this report's out there. Anybody who wants it, we can get you a copy. We're excited to have this ongoing interaction with our state reps. I see Stacy Demis is joining us from Assemblywoman Kellis's office. Thank you, Stacy, for joining. And we're very interested in the future of this legislation that has been introduced. I think it's a Bill 9164 that deals with a new funding formula, which is exciting to us.
And Ben, maybe you can stop sharing, just that would be easier for me to see folks.
Yeah, of course. Thanks for the reminder.
So who has some immediate questions or comments? Robert.
And I got a question, because in your very thorough PowerPoint, I didn't see one point that's been brought to my attention by leadership of the Enfield Volunteer Fire Company. And that is, they have a problem recruiting EMS volunteers. And one of the biggest problems they have is with the state health department. The state health department demands continuing recertification, which is a long, exhaustive process, and they are very rigid in their standards. I was told one anecdotal story of an Army medic who came back and he couldn't be an Enfield volunteer EMS tech because he hadn't taken the state course. And what is being done about that?
So I think that's actually something that we don't address in the report. And it's the reason we didn't address it is that it almost becomes a philosophical issue, because there's fundamentally the choice is, do we want our EMS to become medical providers? Do we want the mobile emergency room, which is the direction that we're moving, or do we want more transport focused agencies? And that wasn't, a philosophical question that we wanted to weigh in on. I would say personally, I think there is a lot of room for rescue type volunteer service. You don't need to be an EMT. There are multiple levels, right? So it really becomes an issue of quality control versus, do we want to locally encourage volunteers as much as we can? That said, one of the most obvious reasons that costs are increasing is that New York State's requirements are getting increasingly stringent and strict. I 100% agree with that.
And I know that our fire chief, Greg Stevenson, thinks that the state is being overly restrictive. And I mean, we in Enfield are not in a position to set up a paid EMT service. We are not going to go the route that Trumansburg went. We don't have the budget to do it. I don't think we have the will to do it. But I think that we do see the need for increased training. There are people in our community who would like to become EMTs, but they don't have the time to take the exhaustive state course. It's a long ways away. Even being a certified first responder is something that we can't get immediate training on. So that's the problem we have in Enfield. And I really don't see your study as addressing that.
I agree that our study does not address it, and it was not aimed at addressing that particular issue. But I will say that in Trumansburg, we just hired a new EMS manager, and one of our primary focuses is establishing free training for local people and establishing that pipeline. That said, it is something that I see as a potential county role, coordinating that kind of training and making sure that it is available for people locally.
Thank you.
Other questions, comments? Joel?
So I'm not sure I fully grasped the thrust of what you're suggesting, Ben. Does it look like we're moving in a direction of creating a substitute for the role that the local fire departments have come to serve in providing sort of first responder services and creating a sort of a parallel track of a medical response network that's different and staffed differently and trained differently? What's the overlap?
Well, no, I don't think that that's necessarily the way that's happening. And certainly in some communities, like in Trumansburg, Mr. Lynch is right to point out that we moved to a paid ambulance staff that does run in parallel to our fire department. So in that sense, that is happening. I think our recommendations are really more generalized community support. So whether you recognize community resources and contributions in terms of volunteer time and training, or in terms of tax dollars, our recommendation is primarily that the state recognize those resources and support those agencies for the sake of the EMS network statewide. I'm not 100% sure I answered your question fully, though, Joel. Did I get it there?
Well, I don't know. It's hard to answer a question when it's so vaguely stated. I guess I share Robert's understanding that it's not just EMS, it's also the fire departments themselves have the same problem trying to recruit volunteers when it takes more and more time and more training. Are we better off with really well trained, skeleton crews, or to what extent does it become an impediment to participation at all when you it kind of drives it toward professionalism, but then some of us are in a bind as far as being able to afford that in the more rural parts of the county. So I was kind of hoping that you would be addressing that overall question, because it's kind of at the core of it all, really.
And Joel, I see this as an opportunity to, for Ben and Dan to see what maybe wasn't illuminated as much, and they might circle back around with us. We have 4 more minutes, so I'm going to turn to Stacy and then Deborah. Stacy,
I feel bad. I saw that. So I felt bad because I saw Deborah's hand up first. But I will go. Thank you so much for this report, and thank you for such a detailed information. And I agree, it is a very large problem, and Assemblymember Kellis actually met today with central staff regarding this bill and a packet of bills that are all EMS. I'm putting them in the chat now. That are all EMS related or possible solutions. She's teaming up with Assemblyman Santa Barbara to push these items into the budget. And so hopefully there will be movement there is concern, however, from the for-profit ambulances to move in a different direction. And so right now at the state level, we're having negotiations on how to address the real struggles that upstate has versus downstate, and how to resolve that, where we're not necessarily alienating the for-profit ambulances, but we're establishing that they don't have an incentive to come out to the rural areas. And also along with trying to address also Medicaid reimbursement rates, and we're going to the fire department. Fire departments are not allowed to request Medicaid reimbursement rates. So this is a multi tier issue, and we're trying to resolve it in different directions and teaming up with other legislators.
Thank you, Stacy. And Stacy and Deborah, you should just be glad I even saw your hand. So Deborah, go ahead.
Maybe you need glasses, Fred.
Yeah, well, I tend not to look for that. So I look for this, so anyway.
Yeah. No, I was just going to say, I think, more to further to what Stacy just said, our county is a microcosm of the state at large. We have a concentration of population in a small area in the city and the town of Ithaca. And then there's the rest of the county that's where the economics and the population just will not support private ambulance services. And more importantly, I think that's where you get into the question of whether you want mobile emergency rooms or transportation. Because I think the further out you get into the hinterlands of Tompkins County, and the difficulties that you're running into getting volunteers because of the training requirements, maybe what you need out there is transportation. I don't know. On the other hand, they're farther away from a hospital. And so you might want the emergency room. I don't know how you balance that. And I suspect that the state's not going to allow the county to make that decision. The state's going to make that decision for us. And that's the crux of the problem.
Thank you, Deborah. And so, yes, we're going to be talking about this more. Ben, thank you very much for your presentation, and Dan for having a class work on this issue. So I had no idea that Ben was a student of yours.
Excellent student, by the way.
What's that?
He got an A for this.
Good.
Thank you, Brad.
Thank you very much, Ben. So moving on to another topic, smart meters. So we have Gavin Mosley, who's the program manager for government affairs with NYSEG here, and Veronica Dasher. I think I recognize you from another meeting. So also another representative from NYSEG here. Gavin, if you haven't noticed, is also a recent awardee of a Young Professional Chamber Tompkins Connect Award. So congratulations, Gavin, on that. So Gavin, I believe that you have a presentation for us as well. Is that correct?
That is correct, and I'm getting it queued up right now, Rod. Can everybody see my screen?
Yes.
Great. Well, y'all, I wanted to just give a couple of quick thanks before I get started. Rod, thank you for allowing me to share with you all today. Again, my name is Gavin Mosley. I am the program manager for government and community relations with NYSEG. I've met many of you, but for those that I haven't met, great to meet you as well. I represent Tompkins County, Schuyler County, and Tioga County with NYSEG. And in that capacity, I do a myriad of things, one of which I'm happy to talk to you about today, which are the smart meter upgrades that we're planning on doing over the next few years in the area. Ithaca has the honor of being the first area. Our Ithaca division, which includes the city of Ithaca, all of Tompkins County, has the honor of being the first division that we'll be rolling this out in. And Rod, I must say, the stakes are pretty high because I'm coming on after my classmate, Ben Carver, as well as my mentor and former Professor Dan Lamb. So I'm going to do my best to be brief, to the point. And y'all, what we'll do, I'll run through the presentation. I'll take a couple of questions. If you have any major questions, I know that there are a lot of questions in the community right now in relation to a lot of the things that we have going on at NYSEG. So any questions that you may have outside of this, or questions that you may have that need extensive answering, or maybe a little bit of vetting, I'll give my information at the end, and you can feel free to reach out to me, and I'll do my best to get those answered. I know we have about 10 to 15 municipalities on the call, so I want to make sure that we're using the best approach to our time. Real quickly, try to start this presentation, make this presentation as interactive as possible, as they're supposed to be in person. So if you could, for those that have access to your chat box, just drop in a couple of words. When I say the word smart meters, what comes to your mind? And I'm going to see if I can get my chat box pulled back up. Just a couple of things that come to your mind. Stop share for a second. A couple of things that come to your mind when we say smart meters. Stacy, I know you have a couple. So we got using energy when demand is low to get cheaper prices. I think you've already seen my presentation, Cynthia. I can go home. Dynamic programming. Okay, Ben. Okay, I see your SEPA hat working. Anybody else? Those are a couple of good ones. Maybe some of the negative things you've heard about smart meters, because we'll be talking about ways that we're working around those. Maybe one or two more people if you have access to your chat box. Anybody? No takers? All right. Hold on. I saw something about a washer. Independent monitoring, not using my washer and dryer when I want to. Okay. That's an interesting angle. Okay. Well, look, I'm going to go back to sharing screen, and we're going to get into the discussion. We're going to talk about some of those concerns. We're going to talk about why we at NYSEG feel like this is a great time to roll this particular product out. Why we think that it's going to give you as the customer and the consumer more choice in the way that you use your energy dollars. As well, a lot of you all are elected officials. I think the majority of you all are elected officials. Why we think that this is a program that's going to bring a lot of value to your constituents. And we all know, if we're going to be frank, this is something that's very important as we're moving through an election year. So again, I'm going to move through the PowerPoint. I'm going to get those questions answered as they come about. And any that come out afterwards, we'll make sure that we get those answered as well. So we've kind of already walked through the basics. So what NYSEG is going to begin upgrading existing meters in the Ithaca division with smart meters. You already know that those smart meters, they use a two-way wireless communication, securely enabled to detail hourly usage information and meter status so that the customers can make informed decisions to get the most out of every energy dollar that they spend. This is nothing new, you all. These are some upgrades that were approved by the New York Public Service Commission in 2020. As we know, things have lagged behind because of the pandemic. We feel like now is a good time. Now is the appropriate time for us to get to work on rolling this out. So the why, it's real simple. And it's really similar to the work that you all do in elected capacity. We're dedicated to meeting energy needs of the customer, your constituents, and taking steps to build a smarter energy infrastructure. Smart meters, they're convenient. They give more control to the consumer, and they offer an expanded choice in understanding and managing energy use. Put a pinpoint there. Did anybody have any core questions as to the what and the why? All right, seeing none, we're gonna move forward. This map kind of details for us the way in which that we'll be approaching the rollout. So as you can see, we'll be starting in the Northwest and moving into Central. You all are considered in Tompkins County to be our central population. That's where we'll be moving from Northwest. We'll be going into the Northeast, so going into some of those areas closer to Cortland County. And then we'll be coming back south, moving into Tioga County. I know on this PowerPoint, it says July 2022 to April 2023. That's about a month or two off. So we're still looking at a 2022 to 2023 timeline. So you can again look for these upgrades to be completed throughout 2022 and into 2023. And when we say Ithaca Division, I know a lot of times we get confused. We're not just talking about the city of Ithaca. We're touching all population, rural and urban. Installations are going to occur throughout several counties. It includes portions of Cortland, Cayuga, Seneca, Schuyler, Tompkins, Tioga, and Chemung counties. This slide, again, you see the map. You can also see these are the proposed dates that we're looking at. We'll be doing a targeted outreach campaign. We'll talk a little bit about that later. We'll be doing a targeted outreach campaign throughout the summer. After that, we're looking at beginning up in Hector as well as Trumansburg. Then we'll be going through those areas. We'll be moving to some of the bigger areas, such as your Dryden, such as your Lansings, your Danbys, your Carolines, towards the fall. That's the goal again. And again, in January 2023, we're going to come back and we'll be going into some of those smaller areas to replace those meters. We're talking about your Candors, your Cayugas, your Cayuga Heights, your village of Drydens, a lot of those smaller villages. I know one of the questions that came up, and I talked to my director about this morning actually, were for those that were in the initial smart mobility program a few years back that had those meters replaced. That was with Cayuga Heights. And he assured me again that those meters will be being replaced as well. So this presentation is for everyone. Everybody's going to get a new meter, except those that choose to opt out. And that's something, again, we can discuss at a later time if necessary.
Before you move on to the next slide,
Veronica?
can you go back to the previous one?
Yes.
Gavin? All right, thank you.
And Veronica,
Yes.
you're going to introduce yourself, Veronica?
I am. My name is Veronica Dasher. I am a Government and Community Relations Regional Manager for NYSEG and RG&E. Gavin is one of my team members. So I do have some information that is hot off the press, which is that these timeframes may change. The installation schedule is based upon a changeover in our customer relationship management database, which will support the smart meter installation. So there is a chance that we will be starting in September versus in July, but we will make sure that we connect with you all to let you know any updates to the schedule as they become available.
And Veronica, thank you for pointing that out. And again, everyone, I'm going to provide my contact information at the end of this PowerPoint. So as those changes come about, I'm already in communication with many of you all, pretty much all of you all. So as those changes come about, we'll be rolling those changes out, talking to you about it. And again, if questions arise between now and when the rollout occurs, don't hesitate to reach out to me. All right, we're going to keep moving forward. Now, as far as the core of the presentation of why we're presenting with you today, why we're having this conversation today, we know that you all's offices receive calls day in and day out about NYSEG, about the work that we're doing. To be honest, maybe about the work that people perceive that we're not doing. We want to make sure that you have the tools necessary to answer any questions that come about before they even come about. And anything that arises aside from that, you'll have information that you can send back to me and I can work to get an appropriate answer for you. So one of those questions we perceive customers having is about, well, what is this upgrade process going to look like? NYSEG representatives, they'll be upgrading and replacing those meters throughout the Ithaca division, as we've already talked about. You'll be able to identify who's coming and doing those upgrades. They're going to be carrying a photo ID. They'll be in vehicles that display a NYSEG logo. The core here, and I really want to park this here for a second, the upgrades and replacements, we're looking to take approximately 10 minutes. There's going to be a gas replacement process. It's going to be an electric replacement process. I'm going to walk you quickly through what those are going to look like. On the gas side, there's going to be an inspection of the existing gas meter. There's going to be an addition of a module that allows that meter to communicate with the network. The service for gas will not be interrupted. So I know that's one of the questions that small business owners have had. Well, Gavin, what about my gas? If it's a restaurant, if it's one of our breweries, what about our gas? Gas isn't going to be interrupted. Again, we're adding that module. We want that module to allow the meter to communicate to our network. On the electric side, it's going to be a little bit different. And we're going to, again, speak to those needs and those concerns in the next slide or two. Electric meter replacement is going to include removal of the old meter. We're going to inspect that meter box. We're going to install a new meter. We're going to document both the old and new meter because we want to make sure we have accurate readings off of both. Service will be briefly interrupted. And that's where this 10-minute time frame comes into play. We want our customers to have a good idea of how long they can expect to be without electricity. Again, 10-minute process, removal of the old, installation of the new, document both the old and new meter numbers. Service will be interrupted. We're looking at about 10 minutes. Questions there? And again, we're going to speak to some of the concerns that you may have in the next slide or two. I see none.
Yeah, Gavin, we'll just wait and take questions at the end.
That works, Rod. Thank you. All right, so what can customers expect? Hours of installation, they're going to be Monday through Friday, 8 to 4 p.m. If 8 to 4 p.m. doesn't work, no worries there. We're going to have some Saturday hours available for our customers' needs. Customer preparation, the only thing that we ask of the customers is that they have the area around their meter clear to provide sufficient space for our employees to work. If a customer's meter is located indoors, they will require access to the meter. Automatic question that comes up, well, Gavin, we're in the middle of a pandemic. What is this going to look like if someone has to go into someone's home? No problem there. NYSEG has its own set of safety protocols in relation to COVID-19. So what that's going to look like when we're coming to your home, if we need to come inside, we're going to be asking questions. Is someone sick? Do people have a temperature? Has someone been diagnosed with COVID-19? If so, no problem. We'll set up a time that's best convenient for the customer, most convenient for the customer to come back and get those taken. Again, taking those appropriate measures. If a customer's having an electric meter replaced, will they be told when their electricity will be interrupted? We're doing an aggressive outreach campaign. That's going to include going around, putting door hangers in the community to let people know that we're changing the meters out. And if you weren't home and we changed the meter in the process, to let you know that the meter has been replaced. For larger commercial customers, we're going to be reaching out to them as well. We know, we were in a meeting earlier today with the state senator. We know that at the core of a business owner's mind is don't interrupt my business during our peak operations hour. That's why NYSEG is going to be working to have some early morning hours as well as some weekend hours, again, to fit the needs of the customer. Customers will be able to find all of this information that I'm talking about, frequently asked questions, as well as some fact sheets on NYSEG's website, nyseg.com. We're bringing the tools to you again early, and I'll also be sending out to you, each one of you all, I'll be sending the frequently asked questions as well as the fact sheets after this meeting. Now, the core of why, we think the biggest piece here is that the smart meter can help. Go ahead, someone. Was that you, Rod? No? We think the biggest piece here is that the smart meters allow two things. Number one, it allows for us to operate our business in a leaner fashion. But most importantly, it's a convenience factor. And we're going to walk through what those convenience pieces mean for the customer, for your constituents. Number one, and we know that you all have been receiving the calls over the past few months about estimated bills. A person having a question as to why their bills are estimates and off months. These smart meters are going to get rid of that. That's going to allow us to have more time with the customer and allow you to have more time doing the business of an elected official. No more customer reads. So for those that don't want to do bill estimates, they have the option of reading their meter and calling that into NYSEG. There's no need for that. That two-way communication is going to let us know down to the hour what that utility usage is. Fewer on-site visits. You know, one of the things that we've all figured out during the pandemic is that people want as minimal amount of people coming to their house as possible. Fewer on-site visits will be required with these smart meters. Again, another way that we can better do business to fit the needs of our customer. I think the biggest one, and we can all relate to this, is faster outage response. There's no greater pain than your power going out and feeling as if someone doesn't know about that outage. We'll know down to the hour, down to the minute as those outages happen. And that's going to allow for two things. It's going to allow us to pinpoint outages quicker, and it's going to allow us to do diagnostics quicker, which means that we can get power back on, hopefully, quicker. So that's, again, another way that we think that we'll be able to provide value to the customer. And the last one, we know that people aren't moving every day, but smart meters do allow the opportunity for us to make moving a little bit easier for our customers. There are three different, and I'm not going to read through all of this information, but I want to touch for a second on the fact that there'll be three tools that the consumer can use in relation to the smart meter, meters. First one is the Energy Manager software. That's going to be an online tool, going to connect customers with customized recommendations on how they can save on energy cost. After the smart meter is installed, customers will have access to detailed energy usage, again, down to the hour, to better understand how they're using energy in their home or business. The next one's going to be an energy tracking report. If you have a My Account with NYSEG, those reports, they'll be delivered monthly to your inbox. It'll give you a snapshot of what your electricity usage is, and you'll be able to see in live time, as with this graph off to the side, you'll be able to see what the trends are in your usage. If you have that My Account, you want to make sure that your email address has been updated so that you can receive that information as the shift occurs. And the last one is a simple usage alert. In the future, our customers are going to be able to sign up to receive usage alerts. These usage alerts will act very similarly to your meter reads, as well as our outage alerts. Customers will be able to receive those updates about their energy use and their cost to better manage changes and plan for monthly energy bills. A couple of other convenience factors. These smart meters, they use less energy. They'll have the ability to have a little bit more smart pricing options. So that's future smart pricing options that'll let customers, going back to the questions about washers and dryers, and this talks about the control that you'll have in relation to that. You can shift your electricity usage to lower cost times of day so that you'll be able to lower your utility bills. Again, we think this is a game changer. We think that this will allow better control for the customers to have. And the last one is beneficial programs. One of the things that many of you all have called me about, well, Gavin, what type of, people's bills are, what type of rebates are you offering? You'll be able to select from some rebates and promotions on energy saving products or explore energy options. And again, all of this is connected to the smart meter rollout. Now, not going to dwell too much here, but I'm going to talk about, Veronica already talked about our timeline as far as the rollout being pushed out by a month or two. But we are still in the interim going to be doing an aggressive public outreach campaign. And I'm going to walk you through what that open house outreach is going to look like. As you all know, the summer is prime time and it is festival season in Ithaca. So everybody will be out, including me. And I want to make sure, and we want to make sure at NYSEG that we're meeting the needs and reaching every citizen that's humanly possible across Tompkins County. So again, these open houses, they're going to be an open house format. Guests will be invited to show up anytime during a specified window of time. It's not going to be a big PowerPoint, no big frills. These are going to be poster board focus setups. We want people to come out, really see some tangibles about how these smart meters work, be able to ask some questions one-on-one with someone, some hard questions if need be. And we'll be able to answer those in a one-on-one open house capacity. I know one of the questions that'll come up, Tompkins County, I'm a little bit biased. It has one of the best public transit systems, I think, in the country. So we want to make sure that we're highlighting here at NYSEG, we're making sure that these locations for open houses, that they're going to be in convenient locations. We understand that everyone doesn't have access to a car. Going back to the discussions that have happened over the past two presentations about marginalized communities. We want to make sure that everybody has the chance to hear about what will be going on as far as smart meters. And that includes making high priority to the locations, having access to being near public transportation. If the need arises, we're going to arrange for interpretation services at each meeting. Again, making sure that we meet the needs of everyone in the community. Event participation. So aside from that public outreach campaign with the open houses, you'll be seeing me out in the community throughout the summer at different events, talking about smart meters, kind of giving a little bit more information about smart meters to the community. Again, making sure that we're touching the needs of the community and making sure that we're touching all sections of the population. And we'll be doing that at various festivals and events throughout the summer. I believe, Veronica, that begins in May and will run through June, correct?
Again, we'll circle back on the time frame for open houses and event participation, but at present, we are anticipating being out in the summertime.
Okay, good deal. And that's the presentation. So this will be the moment where I'll take a few questions. Again, if we have any questions that need extensive vetting or answering, I'm gonna give you my information after we're done. You're welcome to send those over to me and we'll get those answered. But at this time, Rod, I think we can open up for questions.
And go ahead and stop sharing then I can see folks. I do know Cynthia put a couple of questions in the chat.
Okay.
Cynthia, I think it's for both electric and gas. And then I don't know if you can see her second question is, if a resident has solar panels, do they need to do something to prepare ahead of time to keep NYSEG staff safe?
Cynthia, that's an excellent question. And that's going to be one of those questions because it hasn't come up. Veronica and I are going to talk offline about it over the next day or so. And I'll work to get an answer to you no later than Monday or Tuesday. Will that work? Good deal.
Yes, it would. Thank you.
Yeah, no worries.
And you can use your washer and dryer whenever you like.
I know that people were saying that, so I just wanted to bring it up.
Linda?
I just wanted to say Keokuk Heights was in the pilot program and it went very smoothly. It's lovely not having to read your meters, especially when it's minus 20 degrees outside. And I see absolutely no downside to it at all. So.
Well, Linda, if I tell our communications team to reach out to you to get a sound clip now, don't be hesitant.
Maybe. Though I will say the one thing that I've been disappointed in is being able to really use the information to figure out ways to save energy. I don't find the way it's presented in the bills to be very helpful.
Okay.
That could be better.
If you could send me an email about it, because I know that's something that our leadership would be interested in hearing. If you could send me maybe an email about your experience with maybe the energy manager piece or the other pieces, and I can take that back to them and we can see, what the issues are there or if it can be made more useful. So
one of the big issues is that it's hard to know how much energy, how much the pricing difference is. The pricing difference, at least when I looked at it a while ago, was so minuscule that it just didn't make it worth to even begin to think about when you were going to schedule washing and drying your clothes. So.
Okay.
Are you referring to, say, if you were to go to a time of use rate to try to save money, you weren't able to adequately see how, because of the way the information was presented, how you would be able to?
That was part of it. Yes.
Time of use rate? Okay.
Yeah.
Okay.
It was just muddled. The way the whole thing was presented was not easy to follow. So.
Yeah.
And the price difference was, not worth it. I don't know if any of that has changed. So.
And Gavin, did you say even those that participated in the pilot program, they're going to get new meters as well?
Yes, and I checked that was a question that had come up. I checked with my director this morning and he said absolutely yes.
Okay. Other questions? Stacy, I see your hand, Stacy.
Hey, Stacy.
Hi. Let me lower my hand. It does blend into the background. I see that. Really quick questions. As you probably are aware, the utility shut-off moratorium was lifted at a few weeks ago. And out of curiosity, if a person's electricity bill is about to be shut off, does the smart meter give them the advantage of, or gives the company an advantage of doing it immediately? And then if so, when we get to below, I forgot the code blue cutoff temperature, could NYSEG automatically switch them back on, even if they are shut off?
Stacey, I'm going to be honest with you, and Veronica can maybe give a little bit more background on it, or maybe something we have to take back to the team at large. It's not a question that I've had as of yet, so I'm not quite sure. Veronica, do we have any idea on that? Is that something we need to talk with the higher ups about?
I can give you a partial answer to that question. And in terms of the part about the code blue, it's 32 degrees.
Thank you.
And I need to check on that for you. So that's something that we'll go back and ask customer service about. So yes, smart meters allow us the ability to remotely turn service on and off. So if a customer's moving into a residence, they don't have to wait for us, 4 days a week, however long it takes to be able to turn the meter on. It does automatically allow us to shut service off. And that includes for non-payment. However, even though the moratorium expired and even the grace period afterward, we still have not begun collections, and we're working actively with county and state government on trying to help find alternatives to help customers with their arrears who were impacted by the COVID-19 pandemic. So, I mean, we have a number of options available for customers to try to help them through financial worries, such as, you know, the HEAP program. It's not our program, but we partner very closely with social services. We invest in Project Share, which is a last resort and safety net for customers who need assistance. It's a private fund that we donate to. And then we also offer a suite of payment programs, payment arrangement programs. There's arrears forgiveness. We have customer service advocates. So even within our business, there are a number of safety nets that are available for customers to try to prevent them from even getting to the point of being shut off. But we'll also double check for you on your question specifically about whether the service gets turned back on if customers go into a code. I believe you referred to it as a code blue day, correct?
Right. Correct. Thank you. And then, so just to be clear, the electric and the gas can be remotely turned on and off, or you guys are going to find that information out?
It can be remotely turned on and off, correct?
Not with gas.
Not with gas. Okay.
Not with gas.
Not with gas.
Okay. And then my second question is, given we are getting a ton, and I mean a ton of calls right now regarding an increase to their bill, their bills. And I'm wondering, is this a correlation to these smart meters being rolled out?
No.
No. Okay.
So, and I'll point out, Stacy, so I know I do a lot of work. So I know Anna has called, Senator Kellis has called me about a couple of those, as well as Jen.
Mm-hmm.
So if any of those constituent issues arise, definitely send them my way, and we'll get them looked into, just as I've been getting them looked into when Jen sends them over. But no, those are not related to the smart meter rollout.
Okay. All right. Thank you.
Robert.
Yes, couple questions. I'm an old journalist, so the 5 W's of journalism, one of them is why. And I haven't heard the explanation as why. Why are we doing this?
Well, and Rob, I think that's an excellent question. I think going back to the beginning of the slide, and it's going to sound cliche, and we may have to talk a little bit more about it offline. We think that it's a smarter way for us to do business, and we think that it's going to provide great value for our customers. In short, it's going to allow us to run a leaner operation. It's going to allow us to read those meters again virtually, so we won't have to send someone out to actually physically read the meter. And going back to the point that Stacy just brought up, and one of the concerns that a couple of other people have brought up, goes back to that response time. If a person's power goes out, we're going to be able to know in real time that it's out and work to get it back on quicker. So those would be the why.
Do you expect any pushback from some people who say this is Big Brother intruding into my electric usage?
Oh, absolutely. We know we're going to receive some pushback. And one of the concerns, and that's a great question, Rob. I know that's come up in a couple of other meetings that Veronica and I have sat in on. We're not selling data, and I stand on that. So I will feel comfortable getting out when we're doing that public outreach, as those questions come up, to let the consumer and let your constituents know that's not what we're doing. We think that, again, that it'll provide a little bit greater value for them and allow us to run a leaner operation.
And how does the differential pricing work with people like me who are on ESCOs?
Now, that is a question I'm going to hand over to Veronica.
As far as price differential, there really wouldn't be any, because if you're with an energy supply company, you have basically signed up for a service. I'm assuming if you have an energy supply company, it's to have a fixed rate with supply, but it may not be that. So their rate for providing you with the commodity itself is their rate, and that in having a smart meter does not change that.
Thank you.
Appreciate you, Rob.
And Joe, you get the last question.
Well, I mean, you alluded to the ability of people to opt out. I've got people in my jurisdiction anyway who are concerned about exposure to electromagnetic radiation. And although there are plenty of skeptics that that's an issue, I actually know somebody who's dramatically affected by it. So although I might not have thought it be potentially real, I have somebody who actually demonstrated to me that it is real. But so anyway, the people who are concerned about that, they can opt out, right?
Yes, consumers definitely can opt out. Now, in full transparency, for those that opt out, there will be a small fee attached. So we want to make sure that we're making sure that we address that upfront and let customers know that each month there will be a fee for opting out. But again, and this, Joel, this is kind of in line with the question that Rob asked. We're going to be talking while we're out in the community about the research we've done and about how minimal any idea towards radiation would be in relation to the smart meters. One of the questions that people had was, well, Gavin, will these smart meters interfere with my microwave? Absolutely not. Gavin, will these smart meters interfere with my cell phone service? Absolutely not. And that's based off the research that we've done. So again, we'll be answering those questions as we're out in the community.
And Katrina, did you have a question about this?
I don't have a question, but Joe Wetmore is in the, he's listed as an attendee and he has his hand up. So I don't know if he had a question.
Oh, I don't. Joe, do you have a question? You mean Joel, right?
Oh, Joe, he didn't promote to a panelist, so I don't know if he has a connection issue, but his hand is up in the, listed as an attendee.
I don't even, there's Joe.
There he is.
There, okay.
Joe.
Hi
go
there.
ahead.
Can I speak?
Yes,
Hey, Joe.
go ahead.
I don't have a question now. I had a question at an earlier speaker, but I was unable to speak on the system because I wasn't promoted enough. So I'm good. Thank you.
Okay. And there's just one to the, are these meters using 5G?
We will have to follow up.
We'll have to follow
We'll have
up
to
on
follow
that.
up. That is the first time that we were asked that specific question, but we will not be stumped anymore by it.
It's a good question to have these days.
It is.
So Gavin and thank you very much, Gavin and Veronica. I lost Veronica. Where is she? Gavin and
I'm
Veronica,
still here.
thank you so much for the presentation. I know there will be questions, but
Yep.
this was a good sort of heads up, and keep us posted.
Will do. And Rod, what I'm going to do real quickly, everyone that does not have my email handy, I'm going to go ahead and give that out. My email address, G Mosley, and I'll put it in the chat as well. G Mosley, GMOSLEY @NYSEG.com. Any questions that come up today or thereafter, send them to me, and Veronica and I are going to work to get some answers to those. All right.
Great.
Thank y'all.
Thanks, Veronica. Thanks, Gavin. Ben, take care. We're going to try to wrap up fairly quickly here. So subcommittee reports, energy. So there is interest in continuing an energy committee. We met to talk about what would the focus be. We sent that out with the material for the meeting, so I'm not going to review it, but it's all about electric infrastructure in Tompkins County. If we're serious about relying more on electricity, there's going to be issues about that infrastructure. So the committee is going to turn our attention to that. Luis Aguirre Torres developed a very nice statement that went out. So if you didn't get it for some reason, let me know and I will send it to you. And if you're interested in being on the Energy Committee with that as a focus, our first meeting is going to be March 22nd at 3. I think that's what we decided. So let me know and I'll make sure you get the material. And if you have any questions about that. CCA, as you know, had been our focus the past couple of years, community choice aggregation. We are going to provide an update to the municipalities who have been interested in CCA on shoot, I had that in front of me. I don't remember. Joel, do you remember when we're doing that update for municipalities?
No.
Oh, it's February 24th. February 24th, because some people thought it was, oh no, it's March. Anyway, we'll send it out.
Yep.
So now that
Can't be
CCA,
February 24th, that's today.
yeah. Well, and some people are asking me for the recording. I'm like, no, so it's sometime in March. So there's going to be a continuation of an energy committee with a slightly different focus. If you're interested, let me know. And we will make sure you get an invitation to the March 22nd meeting. And I will remind folks when the update for community choice aggregation will be. The city and the town have been working on, with Paul Fenn, on working on moving forward with community choice aggregation. Transportation, is there any update from the Transportation Committee?
I will be very brief. There are some updates with regards to TCAT, which unfortunately has its board meeting at the same time we have ours. So I can't be in two places at once. But I did talk to Scott Vanderpool earlier, and they've got a real staffing shortage problem there, and it's affecting their bus service. Scott says they now have 66 full-time drivers compared to around 82 years ago. A number of bus routes have, bus runs, I should say, have been had to be called off because of either a vehicle needing parts, which they can't get delivery on, or more likely to have the fact they haven't got enough drivers to do it. Now, they can use administrative staff to fill in the gaps, but it is becoming a real problem for them. They're trying to address it as best they can. On the positive side, they are working toward getting more electric buses. I think they said at their last meeting, which I did attend because it was in January on the 27th, they said that they're trying to get 5 more electric buses. I think they're to be delivered in 2023. I don't know exactly the funding for them, but that's positive. They hope to have an all-electric fleet by 2035. There's a lot more, but I will be brief today. And one of the things we'd like to do in the new year is work toward trying to figure out if there's a way to provide a downtown Ithaca bus station, because we really need that in this community, and it's going to be a challenge.
Okay, thank you. By the way, the Zoom meeting about CCA update is March 23rd at 2 o'clock. So just let me know. So March 23rd for the CCA Zoom meeting and March 22nd for the Energy Subcommittee. Any questions for Robert about transportation? Anyone here to report on the Water Quality Subcommittee? And then it says subcommittee structure discussion. Oh, I'm sorry, Linda.
Yeah, I'm not on that committee, but one of the things I think TCOG ought to start talking about is the new EPA ruling that says that there can no longer be any lead in any water pipes. And that's something that every municipality that has water not from wells is going to have to deal with. Those of us who get our water from Bolton Point already have heads up on this, but I think it's something that TCOG ought to be concerned with. I don't know if this water committee has dealt with that or not.
So it will be in the minutes and they'll see that. So thank you, Linda, for mentioning that. Subcommittee structure discussion, was that just to see if there were other committees that wanted to form and move forward? Katrina?
That was in the December minutes, that was one of the things to talk about at this meeting. So, I do believe.
So maybe part of it was, so obviously TCOG meets every other month. That seemed to work well to allow committees to meet in the past in intervening months. So I think that works. So maybe that's what we were trying to check in on. If TCOG is meeting every other month, it gives the subcommittees a chance to meet in the intervening months. Everyone okay with that? Following that schedule? Does anyone know?
That's what it was about.
What's that?
I think that's what it was about, and I think you're summarized the feelings of the group in that regard.
And I don't know, I did see in the minutes that when if there was to be any other subcommittee, it might go back and look at the report that was submitted for consolidation possibilities to see if any of those topics suggested committees start forming around that. So I don't have that list in front of me right now. But if anyone has ideas for another committee that they'd like to potentially put some energy behind and they think there'd be committee members, we can take note of that. Tim?
Yeah, I just had a question. I think this came up before I got involved with TCOG last year. I believe in the recent past, there was a discussion of judicial consolidation. Can somebody tell me, was that taken care of? Is that an ongoing discussion?
I believe that there's a county task force looking at that. Is that correct? Currently looking at that. Does that sound right?
I'm just not sure. I was wondering.
I make things up sometimes. So, but I'm pretty sure that the county is moving forward on studying that issue.
Okay, thanks.
No one's confirming that, so it's making me a little nervous.
I'm not aware of an effort in that direction. I know that several years ago, there was a recommendation about consolidating, for example, the justices' assignments to do arraignments when people were arrested after hours, and there was an enormous amount of pushback from the justices in the various constituent municipalities in Tompkins County. So we really didn't go any further with that, although I think now we're moving towards centralized arraignment that won't so much involve the justices' rotation, but will just allow arraignments to take place downtown, I believe. And then the justices can take turns being there at set hours. But I honestly, I wouldn't bet my firstborn on that either.
Yeah, and Deborah, you're now reminding me that the issue I was thinking about is the county is moving forward on code enforcement, looking at a study about code enforcement.
Mhm.
I think that maybe the issue of courts is still on what we submitted to the state as some topic we might look at in the future in terms of consolidation opportunities.
Yeah, I think you're going to need to get your town justices on board with that, though, and they're going to be your main problem.
Right. That's why it's certainly not on the list that was submitted for things to work on in 2022 for that reason. Robert?
I can share some information regarding justices because I sit on the ABIR committee as well. And they do have consolidated arraignments now, and it's happening up at the sheriff's department. And that's what's happening. The city of Ithaca isn't involved in it, but the town justices are involved in it. So that has pretty much been rectified. I just wanted to add one thing that we discussed in December, the possibility of setting up a communications subcommittee that would deal with both broadband and with cellular telephone service. I just want to mention that.
And by the way, that just says that you also got an email from, well, it was forwarded by Katrina, but it was from Keith Hanna from the village of Trumansburg about a networking opportunity and sharing information about ourselves. So I hope people had a chance to look at that. Linda, did you have your hand up?
I did. I was mostly on the justices. I know that our justice every once in a while does do arraignments throughout the county. So I think there is some program that is doing that at this point, but that's about all. And I share what Deborah said, that there's a lot of pushback by a lot of the justices. And I think also the residents of villages that they don't particularly want it to happen. I've mentioned maybe eliminating our village justice and just using the town of Ithaca's, and it was like I hit the third rail. So
and we should send out an email to new members, just reminding them what the groups are, the committees are, who the key contact is, what their focus is. So Cynthia will work to do that so that you might have interest in being on one of the subcommittees. So Deborah, is that a new hand?
Yeah, I just wanted to thank Bob Lynch for getting me back on track. As I recall, the whole centralized arraignment issue originally arose when we were talking about co-locating the sheriff's department with the IPD. And now Bob is right. The sheriff's department's figured out how to do centralized arraignments at our public safety building up here on Warren Road. So thanks, Bob.
Anything else today? So our next meeting is in 2 months. I don't have the date right in front of me, but hopefully some subcommittees will be meeting in the meantime.
The next meeting's April 28th.
Thank you. Joe, is there anything you want to say before we close? Joe Wetmore?
No,
Go ahead.
I'm good. Sorry, it took me a second to get hooked in. No, I'm good.
Okay. Well, we'll go ahead and close the meeting at 4:46. And stay safe tomorrow. I have no idea what it's really supposed to do tomorrow, but be careful tomorrow. We do know we're going to get some snow. So